Welcome back into Talking Fitchburg. Joining me today is our emergency management folks. Oh, a little bit of everything in emergency management. I've got Chief Joe Pulvermacher from Fitchburg Fire Rescue and Deputy Chief Jeff Dostaleck here from Fitchburg EMS. Guys, thank you so much for taking the time out. I had reached out to you, reached out to Joe asking if we could talk a little bit about the coronavirus. I am not one that likes to jump on the bandwagon with things. However, I do think in an emergency management standpoint, and I'm a big believer in public safety, that there's a bigger picture here. But I do want people to know that, be reassured that behind the scenes, you guys practice for this day in and day out. It can have whatever label it's going to be. It can be whatever it's going to be. But behind the scenes, emergency management and the training that you guys do is second to none. Walk us through just a little bit of emergency management, Joe, and what it is and how it works.
Well, one of the reasons why I asked Jeff to be here today is because of the fact that when you look at emergency management, you're looking at the big picture, everything. And you need to tap from your experts in the room. And with Fitchburg, they've been working with Dane County EMS and even the state to some extent as far as what needs to be done in the event that there's an exposure. Now, I will say this. I mean, I think that the steps that are being taken right now to be able to identify the virus and what it does and what it looks like is good. I don't necessarily think that we have a significant issue at this point to the point where people need to be concerned. There are certain things that are being done at the county level, at the state level, to be able to have certain things in place in the case that there are an outbreak or there is an outbreak. But there's nothing that suggests that we're going to have a widespread issue. So I liken it to this example. You have a fire department because you don't. How do I want to put it? You have a fire department not because you want a fire. You have one just in case a fire happens. Same thing sort of happening at public health is they're putting certain things in place not because they see the immediate need, but if something were to happen, they want to be able to jump into place right now and not have to think about it, to know what the signs and symptoms are and all of those things. I'll let Jeff speak to some of the things that we can do from a control mechanism, even a recognition mechanism, but at the end of the day, if you haven't been to China or you don't know somebody that has and you don't have a fever right now and you're not exhibiting these signs, you really have nothing to be concerned about. I think our bigger concern is the flu. Mm-hmm. And Jeff can talk about that as well.
Oh, don't worry. I've got some graphics ready for you for influenza. But Jeff, this is tough because what this is, when we break it down, the coronavirus, it's really an upper respiratory thing, but it shows signs as the flu. So kind of take us through a little bit of that. And we're trying not to get you extra ambulance calls here by any means, and we'll break that down in just a second. But what are we really looking at here?
Right. So as Joe mentioned, there's a lot of things in place in the event that something does happen. So the things that that you're going to want to look for are the cough. If you're running a fever, if you're short of breath, upper respiratory symptoms. So it's going to look like the flu. Just because you have those things doesn't mean that you have the coronavirus. I think the best thing to do is make sure that you take some of the precautions like washing your hands and staying out of the public if you have those things. Contact your healthcare provider. I don't necessarily think that you have to call an ambulance unless you're having severe respiratory distress where you can't catch your breath and you really need some help. But if you just have the regular signs and symptoms of the flu, contact your healthcare provider. They're going to ask you the same questions that that we might ask you, and they'll probably have you shelter in place and kind of monitor that. We're more at risk for the flu in our area than we are for the coronavirus.
On the ambulance side of things, and even fire department, PPE, as your protection mechanisms, whether it's the flu, whether it's something, if you guys do don masks on or have extra protection on, that doesn't mean it's the end of the world for the patient. It starts with personally protecting yourself and also protecting the patient as well. So if they do happen to see this, Jeff, what's going on here and why are our folks doing this?
Right. So we just want to make sure that we don't spread the disease, or the flu when that happens. So we'll be, have our masks and our gloves on. We'll have just like a regular HEPA mask on. And that's just to protect us, and that's also to protect the patient in the event that maybe we have gotten something that hasn't manifested itself yet as well. If you're able to wear a mask, the provider may ask you to put a mask on as well, but if you're short of breath, that might be more difficult to do than not. So just look for those things. Know that we're just protecting ourselves. It doesn't mean that we have the coronavirus or that we even have the flu. We just don't want to spread anything, and that's why we wear them.
So when we talk about EMS, some people call it emergency medical service. I like to think of it as an emergency medical system because it involves everything from the time that the call is received at dispatch to the first arriving responders, whether that's police, fire, or EMS. There's a lot of things that really need to be identified in advance of arrival on scene. So dispatch can be asking some questions. If we're being sent to a situation where somebody's feeling ill, we can have some information in advance of our arrival. We can identify some of the different risk factors that may exist with this specific virus. But at the end of the day, I think one of the things that I realized, I've been riding with EMS or doing some form of emergency service for 31 years, and I remember being a brand new EMT and picking which calls I wore gloves on, whether it was medical or trauma, and now every call gets a glove. Every call should have eye protection, and we're just seeing the transition with PPE to the point where we do see our providers using it more often, because why put yourself through an exposure that you don't have to? People are calling us for a reason. They're having a bad day. We hope to be able to assist them through that process, help them feel better, but by putting ourselves in harm's way and introducing our responders to higher risk environments doesn't serve any purpose.
Absolutely. And we still have, you just made me think of confidentiality here too, that if somebody is in that, frame of mind or whatever, your focus is the patient. It's not blowing this out of proportion. It's taking care of the patient, sticking with the HIPAA laws and stuff, and getting that patient delivered and whatnot. If this was to open up, Joe, into something bigger, Joe Pulvermacher.
I'm very busy.
I know, as an emergency manager here.
Yeah. Look, it's the CDC. No, I'm kidding.
Oh, gosh. On that confidentiality stuff, if this were to open up to a little bit bigger, obviously we're not trying to expose anybody's name or anything, but what would be some of the steps in an emergency management standpoint? And you can comment on the other part too. But
yeah, what we want to do is we want to identify where our areas of concern are. We do know that quarantine happens a number of different ways, whether that's in a clinical scenario or at home. From a HIPAA standpoint, we will never release the name of any of our patients. And you can see that now, even nationwide. We know that at one point, it was 5 different cases that they were following. You don't know a single name of any one of those people, and that would be the same. And so if you were to exhibit signs and symptoms of anything, and you're going to be closely monitored, that would be between you and your doctor or the healthcare system. It's important to be able to maintain that confidentiality. Nobody's personal information needs to be out there. Now, family and friends have a tendency of finding out, but that release typically comes from family and friends, unfortunately. When you want to keep things private. It does not come from public safety. And we can identify the fact that that is going to be consistent here. From an emergency management standpoint, what we will do if it presents in the area, We will do our best to learn where it is, to identify it through our responders. The point where we think that we need emergency operations set up through an emergency operations center, that's typically going to come with multiple exposures. Right now, Dane County has an EOC set up. It's just opened. It's not staffed at this point, and that's just to collect data and get as much information as possible so that we can be ready for something that looks like it's spreading. And right now, it isn't. The individual that is being treated at UW Health, or are they at home?
They're home shelter.
Home quarantine right now. So the person that is being treated is being monitored, and they had some history with travel. So it does just speak to how things are sort of confined to that patient set right now.
You know, and the other thing too, when we talk about HIPAA, is our providers are trained in recognizing the signs and symptoms of all of the diseases that we have, and while coronavirus is at the top of the list now, you know, the flu is something that we see almost every day, and they take those precautions. And if you were to tell the provider, hey, I have coronavirus, and you know that you do, and I need to go to the hospital because I'm having issues, the providers aren't going to treat you any differently. They're already trained in what they should be doing. They'll put a mask on, they'll put their gloves on, they'll put their eye protection on. You know, they will let the hospital know when they get there that you have a confirmed case, but they're not going to treat you any differently because you have it. So if you need EMS and fire to respond to you, don't hesitate to call. We've had practice in learning what we need to do.
And see, nobody's talking about the multiple schools that were closed this year because there was
this week
influenza, right? Mm-hmm. So I think some of that has to do with the fact that people know what influenza is, they have an idea what it is, and the fact that if treated and if they stay on top of it, not as detrimental to survivability. But here's a brand new virus, and that's why people are concerned. We saw it with SARS, we saw it with swine flu. I mean, given another couple of years, we'll have something else that we will have to address. It's not a matter of not being ready for it. I think we're ready for it. It's trying not to overexcite the situation so that people feel as if it's knocking on their door. It is not right now.
Absolutely. Thank you guys so much for breaking it down. And they're right.
Can I say one more thing, Jeremy?
Joe Pulvermacher, you have the floor.
I would love to inject this. And I think Jeff said it, but I want to make sure that it just is the constant message. And that's, if you're not feeling well, stay home. There's no reason to bring that into work. You will expose other people, whether that's the flu or any common cold. People being exposed are going to create issues, not only for your work environment, but they'll take that home. So, yeah, if you're not feeling well, especially if you start feeling chills or a fever, the best place for you is at home, and making sure you're taking care of yourself so that nobody else is exposed.
Yeah, and take those precautions of covering your mouth when you cough. If you have to go out for some reason, making sure that you wash your hands or using a hand gel for sure until you have a chance to wash your hands. You know, and try not to transmit it to other people or you get sick because other people are out there as well. You can look for more information. We'll start putting stuff up on our Facebook page, and I'm sure the fire department will do that as well. Look for more information from us and from the CDC and then Dane County.
All right.
And the stuff that we've seen on Fact TV already, I think I'm just going to share your page.
Hey, we're here to help. Thank you guys so much for breaking this down today. Yeah, I think there's a lot here. It can be complicated at times, but great information, and I feel a little bit better. No, I'm just kidding. I knew it ahead of time. Yeah, we joke, but in all seriousness, the public safety here in the city of Fitchburg and Dane County is very strong, even in the state of Wisconsin, and we're very lucky that we've got you guys here to make it work.
Absolutely don't want to make light of it, but we don't want to overexcite, and that's the delicate balance of public safety.
That's what you want. So appreciate it. We'll get you back in if we have more questions for you, or else we'll see you guys soon. All right, we'll take a quick break. Got more to come. You're watching Talking Fitchburg.